Hi, million followers and all and fans. How are you and your blood today? It's activist temperature, Professor Suresh back with absolute delight for my 88th video 80 in pipeline for publication on YouTube today, 16th of September 2020. Topic for discussion today is cognitive behavior therapy, CBT, for mental illnesses. The term cognition refers to all process by which the sensory input is transformed, reduced, elaborated, stored, recovered and used. It is concerned with these processes even when they operate in the absence of relevant stimulation, as in images and hallucinations. Cognitive science is the interdisciplinary scientific study of the mind and its process, examines the nature, the tasks, and the functions of cognition in a broad sense. Cognitive scientists study intelligence and behavior with a focus on how systems represent, process, and transform information. Mental faculties of concern to cognitive scientists include language, perception, memory, attention, reasoning, and emotion to understand these faculties. Cognitive scientists borrow from fields such as linguistics, psychology, artificial intelligence, philosophy, neuroscience, and anthropology. The typical analysis of cognitive science spans many levels of organization, from learning and decision to logic and planning, from neural circuitry to modern brain organization. One of the fundamental concepts of cognitive science is that thinking can best be understood in terms of representational structures in the mind and computational procedures that operate on those structures. Cognitive science is an interdisciplinary study of cognition in humans, animals, and machines. It encompasses the traditional disciplines of psychology, computer science, neuroscience, anthropology, linguistics, and philosophy. The goal of cognitive science is to understand the principles of intelligence with the hope that this will lead to better comprehension of the mind and of learning and to develop intelligent devices. The cognitive sciences began as an intellectual movement in the 1950s, often referred to as the cognitive revolution. A central tenet of cognitive science is that a complete understanding of the mind brain cannot be attained by studying only a single level. Cognitive science is an interdisciplinary field, as I told you before. Cognitive scientists work collectively in hope of understanding the mind and its interactions with the surrounding world, much like other sciences do. The field regards itself as compatible with the physical sciences and uses the scientific method as well as simulation or modeling, often comparing the output of models with aspects of human cognition. Similarly to the field of psychology, there is some doubt whether there is a unified cognitive science, which have led some researchers to prefer cognitive sciences in plural. The term cognitive and cognitive science is used for any kind of mental operation or structure that can be studied in precise terms. This conceptualization is very broad and should not be confused with how cognitive is used in some traditions of analytical philosophy, where cognitive has to do only with the formal rules and truth conditional semantics. The earliest entries for the word cognitive means roughly pertaining to the action or process of knowing. The first entry from 1586 shows the word was at one time used in context of discussions of Platonic theories of knowledge. Most in cognitive science, however, presumably do not believe their field in the study of anything as certain as the knowledge sought by Plato. Artificial intelligence (AI) involves the study of cognitive phenomena in machines. One of the practical goals of AI is to implement aspects of human intelligence in computers. Computers are also widely used as a tool with which to study cognitive phenomena. Computer modeling uses simulations to study how human intelligence will be structured. Memory allows us to store information for later retrieval. Memory is often thought of as consisting of both long-term and short-term store. Long-term memory allows us to store information over prolonged periods. We do not yet know the practical limit of long-term memory capacity. Short-term memory allows us to store information over short time scales. Cognitive scientists study memory just as psychologists do, but tend to focus more on how memory bears on cognitive process and the interrelationship between cognition and memory. Perception is the ability to take in information via the senses and process it in some way. Vision and hearing are two dominant senses that allow us to perceive the environment. Consciousness is awareness whether something is an external object or something within oneself. This helps the mind having the ability of experience or to feel a sense of self. Brain imaging involves analyzing activity within the brain while performing various tasks. This allows us to link behavior and brain function to help understand how information is processed. Different types of imaging techniques vary in their temporal and spatial resolution. Brain imaging is often used in cognitive neuroscience. Cognitive science has given rise to models of human cognitive bias and risk perception and has been influential in the development of behavioral finance, part of economics. It has also given rise to a new theory of the philosophy of mathematics and many theories of AI, persuasion, and coercion. It has made its presence known in the philosophy of language and epistemology, as well as constituting a substantial wing of modern linguistics. Fields of cognitive science has been influential in understanding brains, particular functional systems, and ranging from speech production to auditory processing and visual perception. It has made progress in understanding how damaged particular areas of the brain affect cognition, and it has helped uncover the root causes and results of specific dysfunctions such as dyslexia, anopia, and hemispatial neglect. Epistemics is a term coined in 1969 by the University of Edinburgh, then the foundation of its school of epistemics. Epistemics is to be distinguished from epistemology in that epistemology is a philosophical theory of knowledge, whereas epistemic signifies the scientific study of knowledge. Christopher Longat Higgins has defined it as the construction of formal models of the process by which knowledge and understanding are achieved and communicated. In the mid 1980s, the School of Epistemics was renamed as the Center of Cognitive Science (CCS). In 1998, CCS was incorporated into the University of Edinburgh School of Informatics. Cognitive psychology is the scientific study of mental processes such as attention, language use, memory, perception, problem solving, creativity, and thinking. The origin of cognitive psychology occurred in the 1960s in a break from behaviorism, which had held from 1920s to 1950s that unobservable mental processes were outside of the realm of empirical science. This break came as researchers in linguistics and cybernetics as well as applied psychology used models of mental processing to explain human behavior. Such research became possible due to the advances in technology that allowed for the measurement of brain activity. Much of the work derived from cognitive psychology has been integrated into other branches of psychology and various other disciplines such as cognitive science, linguistics, and economics. The domain of cognitive psychology overlaps with that of cognitive science, which takes a more interdisciplinary approach and includes studies of non-human subjects and AI. From the 1920s to the 50s, the main approach to psychology was behaviorism. Initially, its adherents viewed mental events such as thoughts, ideas, attention, and consciousness as unobservable, hence outside the realm of a science of psychology. One pioneer of cognitive psychology who worked outside the boundaries of behaviorism was Jean Piaget. From 1926 to the 50s and into the 1980s, he studied the thoughts, language, and intelligence of children and adults. In the mid 20th century, three main influences arose that would inspire and shape cognitive psychology as a formal school of thought. With the development of new warfare technology during World War II, the need for a greater understanding of human performance came to prominence. Problems such as how to best train soldiers to use new technology and how to deal with matters of attention while under duress became areas of need for military personnel. Behaviorism provided little, if any, insight into these matters, and it was the work of Donald Broadbent, integrating concepts from human performance research and the recently developed information theory, which forged the way in this area. Developments in computer science would lead to parallels being drawn between human thought and computational functionality of computers, opening entirely new areas of psychological thought. Alan Newell and Herbert Simon spent years developing the concept of AI and later worked with cognitive psychologists regarding the implications of AI. This encouraged the conceptualization of mental functions pattern on the way that computers handle such things as memory storage and retrieval, and it opened an important doorway for cognitivism. Noam Chomsky's 1959 critique of behaviorism and empiricism more generally initiated what would come to be known as cognitive revolution. In 1960, Bruner and Miller founded the Harvard Center for Cognitive Studies, which institutionalized the revolution and launched the field of cognitive science. Formal recognition of the field involved in the establishment of research institutions such as George Mandler's Center for Human Information Processing in 1964. Mandler described the origins of cognitive psychology in a 2002 article in the Journal of History of Behavioral Sciences. The main focus of cognitive psychology is on the mental process that affect behavior. Those processes include but not limited to the following three stages of memory: sensory memory storage, holds sensory information; short-term memory storage, holds information temporarily for analysis and retrieves the information from long-term memory. Long-term memory holds information over an extended period of time, which receives information from the short-term memory. Though working memory is often thought of as just short-term memory, it is more clearly defined as the ability to process and maintain temporary information in a wide range of everyday activities in the face of distraction. Modern conceptions of memory are usually about long-term memory and break it down into three main subclasses. These three classes are somewhat hierarchical in nature in terms of the level of conscious thought related to the users. Procedural memory is memory for the performance of a particular type of action. Semantic memory is a encyclopedic knowledge that person possesses. Episodic memory is a memory of autobiographical events that can be explicitly stated. The psychological definition of attention is a state of focused awareness on a subset of the available perceptual information. A key function of attention is to identify irrelevant data and filter it out, enabling significant data to be described to the other mental process. Attention can be divided into two major attentional systems: exogenous control and endogenous control. Exogenous control works in a bottom-up manner and is responsible for orienting reflex and pop-out effects. Endogenous control works top-down and is more deliberate attention system, responsible for divided attention and conscious processing. One major focal point relating to attention within the field of cognitive psychology is the concept of divided attention. Perception involves both the physical senses as well as the cognitive process involved in interpreting these senses. Essentially, it is how people come to understand the world around them through the interpretation of stimuli. Current perspectives on perception within cognitive psychology tend to focus on particular ways in which the human mind interprets stimuli from the senses and how these interpretations affect behavior. Metacognition, in a broad sense, is a thoughts that a person has about their own thoughts. More specifically, metacognition includes things like how effective a person is at monitoring their own performance on a given task, self-regulation, a person's understanding of their capabilities on particular mental tasks, the ability to apply cognitive strategies. Common phenomena related to metacognition include deja vu, feeling of a repeated experience, cryptomnesia, generating thoughts, thought believing it is unique, but it is actually a memory of a past experience, also known as unconscious plagiarism. False fame effect. Non-famous names can be made to be famous. Validity effect. Statements seem more valid upon repeated exposure. Imagination inflation. Imagining is an event that did not occur and having increased confidence that it did occur. Modern perspectives on cognitive psychology generally address cognition as a dual process theory expounded upon by Daniel Kahneman in 2001. Kahneman differentiated the two styles of processing more, calling them intuition and reasoning. Intuition, or system one, similar to associative reasoning, was determined to be fast and automatic, usually with strong emotional bonds included in the reasoning process. Kahneman said that this kind of reasoning was based on formed habits and very difficult to change or manipulate. Reasoning, or system two, was slower and much more volatile, being subject to conscious judgments and attitudes. Following the cognitive revolution and as a result of many of the principal discoveries to come out of the field of cognitive psychology, the discipline of CBT evolved. Aaron T. Beck is generally regarded as a father of cognitive therapy. A particular type of cognitive behavior therapy treatment, CBT. His work in the areas of recognition and treatment of depression has gained worldwide recognition. In his book titled Cognitive Theory of Depression, Beck puts forth these three salient points with regard to this reasoning for the treatment of depression by means of therapy or therapy with an antidepressants versus using a pharmacological only approach. Despite the prevalent use of antidepressants, the fact remains that not all patients respond to them. Beck cites that only 60 to 65% of patients respond to antidepressants, and recent meta-analysis show very similar numbers. Many of those who do respond to antidepressants end up not taking the medications for various reasons. They may develop side effects or have some form of personal dejection to taking the drugs. Beck posits that the use of psychotropic drugs may lead to an eventual breakdown in the individual's coping mechanism. His theory is that for the person essentially becomes reliant on the medication as a means of improving mood and fails to practice those coping techniques typically practiced by healthy individuals to alleviate the effects of depressive symptoms. By failing to do so, once a patient is weaned off the antidepressants, they often are unable to cope with the normal levels of depressed mood and feel driven to reinstate use of antidepressants. Social cognition is a special subset of social psychology that concentrates on processes that have been of particular focus within cognitive psychology, specifically applied to human interactions. Now, social cognition is defined by Gordon Moskowitz as study of mental process involved in perceiving, attending to, remembering, thinking about, and making sense of the people in our social world. Many of the prominent names in the field of developmental psychology based on understanding of development of on cognitive models. One of the major paradigms of developmental psychology, the theory of mind, TOM, shortly deals specifically with the ability of an individual to effectively understand and attribute cognition to those around them. Concept typically becomes fully apparent in children between the ages 4 and 6. Essentially, before the child develops TOM, theory of mind, they are unable to understand that those around them can have different thoughts, ideas, or feelings than themselves. The development of TOM is a matter of metacognition or thinking about one's thoughts. Jean Piaget also says the same thing. Okay, the child must be able to recognize that they have their own thoughts and in turn that others possess thoughts of their own. One of the foremost minds with regard to developmental psychology, Jean Piaget, focused much of his attention on cognitive development from birth through adulthood. Though there have been considerable challenges as part of his stages of cognitive development, they remain a staple in the realm of education. Piaget's concepts and ideas predated the cognitive revolution but inspired a wealth of research in the field of cognitive psychology, and many of his principles have been blended with modern theory to synthesize the predominant views of today, even in ethics and all that. Okay, modern theories of education have applied many concepts that are focal points of cognitive psychology. Some of the more prominent concepts include metacognition. Metacognition is a broad concept encompassing all manners of one's thoughts and knowledge about their own thinking. A key area of educational focus in this realm is related to self-monitoring, which relates highly to how well students are able to evaluate their personal knowledge and apply strategies to improve knowledge in areas in which they are lacking. Declarative knowledge and procedural knowledge. Declarative knowledge is a person's encyclopedic knowledge base, whereas procedural knowledge is a specific knowledge relating to performing particular tasks. The application of these cognitive paradigms to education attempts to augment a student's ability to integrate declarative knowledge into newly learned procedures in an effort to facilitate accelerated learning. Knowledge organization, applications of cognitive psychology's understanding of how knowledge is organized in the brain has been a major focus within the field of education. In recent years, the hierarchical method of organizing information and how that maps well onto the brain's memory are concepts that have proven extremely beneficial in classrooms. Cognitive neuroscience is a scientific field that is concerned with the study of the biological process and aspects that underlie cognition, with a specific focus on the neural connections in the brain which are involved in mental process. You know, it addresses the questions of how cognitive activities are affected or controlled by neural circuits in the brain. Cognitive neuroscience is a branch of both neuroscience and psychology, overlapping with the disciplines such as behavioral neuroscience, cognitive psychology, physiological psychology, and affective neuroscience. Cognitive neuroscience relies upon theories in cognitive science coupled with evidence from neurobiology and computational modeling. Parts of the brain play an important role in the field. Neurons, neural network is used in computers also. Okay, neurons play the most vital role since the main point is to establish an understanding of cognition from a neural perspective, along with the different lobes of the cerebral cortex. Methods employed in cognitive neuroscience include experimental procedures from psychophysics and cognitive psychology. Functional neuroimaging, electrophysiology, cognitive genomics, and behavioral genetics. Studies of patients with cognitive deficits due to brain lesions constitute an important aspect of cognitive neuroscience. The damages in lesion brains provide a comparable starting point on regards to healthy and fully functioning brain. These damages change the neural circuits in the brain and cause it to malfunction during basic cognitive process such as memory or learning. With such damage, we can compare how the healthy neural circuits are functioning and possibly draw conclusions about the basis of the affected cognitive process. Also, cognitive abilities based on brain development are studied and examined under the subfield of developmental cognitive neuroscience. It shows brain development over time, analyzing differences and concocting possible reasons for those differences. Theoretical approaches include computational neuroscience and cognitive psychology. Cognitive neuroscience is an interdisciplinary area of study that has emerged from neuroscience and psychology, as I said before. There were several stages in these disciplines that changed the way researchers approach the investigations that led to the field becoming fully established. Although the task of cognitive neuroscience is to describe the neural mechanisms associated with the mind, historically it has progressed by investigating how a certain area of the brain supports a given mental faculty. One of the predecessors to cognitive neuroscience was phrenology, a pseudo-scientific approach that claimed that behavior could be determined by the shape of the scalp. New brain mapping technology, particularly functional magnetic emission tomography, fMRI, and positron emission tomography, PET, allowed researchers to investigate experimental strategies of cognitive psychology by observing brain function. The term psychology has been waning in the 1950s and 1960s, causing the field to be referred as just cognitive science. Cognitive behavioral therapy, CBT, is a psychosocial intervention that aims to improve mental health. CBT focuses on challenging and changing unhelpful cognitive distortions and behaviors, improving emotional regulation and the development of personal coping strategies that target solving current problems. Originally, it was designed just to treat depression, but its uses have been expanded to include treatment of a number of mental health conditions, including anxiety. CBT includes a number of cognitive or behavior psychotherapies that treat defined psychopathologies using evidence-based techniques and strategies. CBT is based on a combination of the basic principles from behavioral and cognitive psychology. Evidence-based treatment is used even in naturopathy. It is different from historical approaches to psychotherapy, such as psychoanalytic approach, where the therapist looks for the unconscious meaning behind the behaviors and then formulates a diagnosis. Instead, CBT is a problem-focused and action-oriented form of therapy, meaning it is used to treat specific problems related to a diagnosed mental disorder. The therapist's role is to assist the client in finding and practicing effective strategies to address the identified goals and decrease the symptoms of the disorder. CBT is based on the belief that thought distortions and maladaptive behaviors play a role in the development and maintenance of psychological disorders, and that symptoms and associated distress can be reduced by teaching new information processing skills and coping mechanisms. When compared to psychoactive medications, review studies found that CBT alone to be as effective for treating less severe forms of depression, anxiety, post-traumatic stress disorder, PTSD, tics, substance abuse, eating disorders, and borderline personality disorder. Some research suggests that CBT is more effective when combined with medication for treating mental disorders such as major depressive disorder. In addition, CBT is recommended as the first line of treatment for the majority of psychological disorders in children and adolescents, including aggression and conduct disorder. Researchers have found that other bona fide therapeutic interventions were equally effective for treating certain conditions in adults, along with interpersonal psychotherapy, IPT. CBT is recommended in treatment guidelines as a psychosocial treatment of choice. And CBT and IPT, interpersonal psychotherapy, are the only psychosocial interventions that psychiatry residents in the US are mandated to be trained in. The modern roots of CBT can be traced to the development of behavior therapy in the early 20th century, the development of cognitive therapy in the 1960s, the subsequent merging of the two. Groundbreaking work of behaviorism began with John B. Watson and Rosalie Rayner's studies of conditioning in 1920. During the 1950s and 60s, behavioral therapy became widely used by researchers in the US, the UK, and South Africa. The emphasis on behavioral factors constituted the first wave of CBT. One of the first therapists to address cognition in psychotherapy was Alfred Adler with his notion of basic mistakes and how they contributed to the creation of unhealthy or useless behavioral and life goals. Adler's work influenced the work of Albert Ellis, who developed the earliest cognitive-based psychotherapy, known today as rational emotive behavior therapy (REBT). Ellis also credits Abraham Lowe as the founder of CBD. Around the same time that rational emotive therapy, as it was known then, was being developed, Aaron T. Beck was conducting free association sessions in his psychoanalytic practice. During these sessions, Beck noticed that thoughts were not as unconscious as Freud had previously theorized, and that certain types of thinking may be of the culprits of emotional distress. It was from this hypothesis that Beck developed cognitive therapy, which we call CBT now, and we call these thoughts automatic thoughts. Aaron T. Beck has been referred to as the father of CBT. It was these two therapies, rational emotive therapy and cognitive therapy, which started the second wave of CBT, which was the emphasis on cognitive factors. Although the early behavioral approaches was unsuccessful in many of the neurotic disorders, they had little success in treating depression. Behaviorism was only also losing in popularity due to the so-called cognitive revolution. The therapeutic approaches of Albert Ellis and Aaron T. Beck gained popularity among behavioral therapists, despite the earlier behaviorist rejection of mentalistic concepts like thoughts and cognitions. Both of these systems included behavioral elements and interventions and primarily concentrated on problems in the present. In initial studies, cognitive therapy was often concentrated with the behavioral treatments to see which was most effective. During the 1980s and 90s, cognitive and behavioral technologies techniques were emerged into CBT, cognitive behavioral therapy. Pivotal to this merging was the successful development of treatments for panic disorder by David Clark in the UK and David Barlow in the US. Over time, CBT became to be known not only as therapy, but as an umbrella term for all cognitive-based psychotherapies. These therapies include, but are not limited to, REBT, cognitive therapy, acceptance and commitment theory, dialectical behavior therapy, reality therapy, choice theory, cognitive processing therapy, EMDR, and multimodal therapy. All of these therapies are a blending of cognitive and behavior-based elements. This blending of theoretical and technical foundations from both behavior and cognitive therapies constituted the third wave of CBT. The most prominent therapies of this third wave are dialectical behavior therapy, and acceptance and commitment therapy. Despite increasing popularity of third wave treatment approaches, reviews of studies reveal there may be no difference in the effectiveness compared to with the non-third wave of CBT for the treatment of depression. Therapists or computer-based programs use CBT techniques to help people challenge their patterns and beliefs and replace errors in thinking known as cognitive distortions, such as overgeneralizing, magnifying negatives, minimizing positives, and catastrophizing with more realistic and effective thoughts, thus decreasing emotional distress and self-defeating behavior. Cognitive distortions can be either a pseudo discrimination based or an overgeneralization of something. CBT techniques may also be used to help individuals to take a more open, mindful, and aware posture towards cognitive distortions so as to diminish their impact. CBT can be seen as having six phases: assessment of psychological assessment, reconceptualization, skills acquisition, skills consolidation and application training, generalization and maintenance, post-treatment assessment follow-up. These steps are based on a system created by Canfer and Saslow. After identifying the behaviors that need changing, whether they are in excess or deficit, and treatments has occurred, the psychologist must identify whether or not the intervention succeeded. The steps in assessment phase include: step one, identify the critical behaviors; step two, determining whether critical behaviors are excesses or deficit; step three, evaluate critical behaviors for frequency, duration, or intensity, obtain a baseline; step four, if excess, attempt to decrease frequency, duration, or intensity of behaviors; if deficits, attempt to increase behaviors. The reconceptualization makes up much of the cognitive portion of CBT. A summary of modern CBT approaches is given by Hoffman. CBT may be delivered in conjunction with a variety of diverse but related techniques such as exposure therapy, stress inoculation, cognitive processing therapy, cognitive therapy, relaxation training, dialectical behavior therapy, and acceptance and commitment theory. Some practitioners promote a form of mindful cognitive therapy includes a greater emphasis on self-awareness as part of the therapeutic process. In adults, CBT has been shown to have effectiveness and a role in the treatment plans for anxiety disorders, body dysmorphic disorders in the adjustment, depression and anxiety associated with the fibromyalgia and with the post-spinal cord injuries. In children or adolescents, CBT is an effective part of treatment plans for anxiety disorders, body dysmorphic disorder, depression, suicide, suicidality, eating disorders and obesity, obsessive compulsive disorder, OCD, and post traumatic stress disorder, as well as tic disorders, trichotillomania, and other repetitive behavior disorders. CBT, SP, and adaptation of CBT for suicide prevention was specifically designed for treating youths who are severely depressed and who have recently attempted suicide within the past 90 days and was found to be effective, feasible, and acceptable. CBT has also been shown to be effective in post-traumatic stress disorder in very young children, 3 to 6 years of age. Reviews find low-quality evidence that CBT may be more effective than other therapies in reducing symptoms of post-traumatic stress disorder in children and adolescents. CBT has also been applied to a variety of childhood disorders, including depressive disorders and various anxiety disorders. CBT combined with hypnosis and distraction reduces self-reported pain in children. Cochrane reviews have found an evidence that CBT is effective for tinnitus, although there appears to be an effect on management of associated depression and quality of life in this condition. Other recent Cochrane reviews found no convincing evidence that CBT training helps foster care providers manage difficult behaviors in the use under care, nor was it helpful in treating people who abuse their intimate partners. According to a 2004 review by INSERM of 3 methods, CBT was either proven or presumed to be an effective therapy on several specific mental disorders. According to the study, CBT was effective at treating schizophrenia, depression, bipolar disorder, panic disorder, post-traumatic stress, anxiety disorders, bulimia, anorexia, personality disorders, and alcohol dependency. Some meta-analysis finds CBT more effective than psychodynamic therapy. Excuse me. And equal to other therapies in treating anxiety and depression. Computerized CBT, CCBT, has been proven to be effective by randomized control and other trials in treating depression and anxiety disorders, including children as well as insomnia. Some research has found similar effectiveness to an intervention of informational websites and weekly telephone calls. CCBT was found to be equally effective as face-to-face CBT in adolescent anxiety and insomnia. Criticism of CBT sometimes focuses on implementations which may result initially in low quality therapy being offered by poorly trained practitioners. However, evidence supports the effectiveness of CBT for anxiety and depression. Acceptance and commitment therapy, ACT, is a specialist branch of CBT, sometimes referred to as contextual CBT. ACT uses mindfulness and acceptance interventions and has been found to have greater longevity in therapeutic outcomes. In a study with anxiety, CBT and ACT improved similarly across all outcomes from pre to post treatment. However, during the 12-month follow-up, ACT proved to be more effective, showing that it is a highly viable lasting treatment model for anxiety disorders. Evidence suggests that the addition of hypnotism as an adjunct to CBT improves treatment efficacy for a variety of clinical issues. CBT has been applied in both clinical and non-clinical environments to treat disorders such as personality conditions and behavioral problems. A systematic review of CBT in depression and anxiety disorders concluded that CBT delivered in primary care, especially including computer or internet-based self-help programs, is potentially more effective than usual care and could be delivered effectively by primary care therapists. Emerging evidence suggests a possible role for CBT in the treatment of attention deficit hyperactivity disorder, ADHD, hypochondriasis, coping with the impact of multiple sclerosis, sleep disturbances related to aging, dysmenorrhea, and bipolar disorder, and more study is needed, and results should be interpreted with caution. CBT can have therapeutic effects on easing symptoms of anxiety and depression in people with Alzheimer's disease. CBT has been studied as an aid in the treatment of anxiety associated with stuttering. Initial studies have shown CBT to be effective in reducing social anxiety in adults who stutter, but not in reducing stuttering frequency. In the case of people with a metastatic breast cancer, data is limited, but CBT and other psychosocial interventions help with the psychological outcomes and pain management. There is some evidence that CBT is superior in the long term to benzodiazepines and non-benzodiazepines in the treatment of management of insomnia. CBD has been shown to be moderately effective for treating chronic fatigue syndrome. In the UK, the National Institute of Health and Care Excellence (NICE) recommends CBD in the treatment plans for a number of mental health difficulties, including post-traumatic stress disorder (OCD), bulimia nervosa, and clinical depression. CBT has been shown as an effective treatment of clinical depression. The American Psychiatric Association practice guidelines in April 2000 indicated that among psychotherapeutic approaches, CBT and interpersonal psychotherapy had the best documented efficacy for treatment of major depressive disorder. One etiological study of depression is Aaron T. Beck's cognitive theory of depression. His theory states that depressed people think the way they do because their thinking is based towards cognitive interpretations. According to this theory, depressed people acquire a negative schema of the world in childhood and adolescence as an effect of stressful life events, and the negative schema is activated later in life when the person encounters similar situations. Beck also described a negative cognitive triad. The cognitive triad is made up of the depressed individual's negative evaluations of themselves, the world, and the future. Beck suggested that these negative evaluations derive from the negative schemata and cognitive biases of the person. According to this theory, depressed people have views such as I never do a good job, it is impossible to have a good day, and things will never get better. A negative schema helps give rise to the cognitive bias, and the cognitive bias helps fuel the negative schema. Pessimistic, basically. Okay. Beck further proposed that depressed people often have the following cognitive biases: arbitrary inference, selective abstraction, overgeneralization, magnification, and minimization. These cognitive biases are quick to make negative, generalized, and personal influences of the self, thus fueling the negative schema. A 2001 meta-analysis comparing CBT and psychodynamic psychotherapy suggested that approaches were equally effective in a short term. In contrast, meta-analysis of larger trials of different psychotherapeutic treatments, that CBT, interpersonal therapy, and problem-solving therapy for depression, outperform psychodynamic psychotherapy. So many studies have been conducted, and behavioral activation in terms of robustness of effects. CBT has been shown to be effective in the treatment of adults with anxiety disorders. A basic concept in some CBT treatments used in anxiety disorders is in vivo exposure. CBT exposure therapy refers to the direct confrontation of feared objects, activities, or situations by a patient. The results from a 2018 systematic review found that high strength of evidence that CBT exposure therapy can reduce PTSD, post-traumatic stress disorder symptoms, and leads to the loss of PTSD symptoms. Many studies show CBT combined with the pharmacotherapy is effective in improving depressive symptoms, mania severity, and psychosocial functioning, and mild to moderate effects, and that it is better than medication alone. In long-term psychosis, CBT is used to complement medication and is adapted to meet individual needs. Interventions particularly related to these conditions include exploring reality testing, changing delusions and hallucinations, examining factors which precipitate relapse, and managing relapses. Several meta-analyses suggested that CBT is effective in schizophrenia. CBT is used to help people of all ages, but all the therapy should be adjusted based on the age of the patient with whom the therapist is dealing. Customization is essential. Older individuals in particular have certain characteristics that need to be acknowledged, and the therapy altered to account for these differences thanks to age. For anxiety disorders, use of CBT with people at risk has significantly reduced the number of episodes of generalized anxiety disorder and other anxiety symptoms, and also given significant improvements in explanatory style, hopelessness, and dysfunctional attitudes. Use of CBT was found to significantly reduce social anxiety prevalence. For depressive disorders, a stepped care intervention, watchful waiting, CBT, and medication, if appropriate, achieved a 50% lower incidence rate in a patient group aged 75 or older. CBT is also used for pathological and problem gambling. CBT looks at the habit of smoking cigarettes as a learned behavior, which later evolves into a coping strategy to handle daily stresses because smoking is often easily accessible and quickly allows the user to feel good. It can take precedence over the coping strategies and eventually work its way into everyday life during non-stressful events as well. CBT aims to target the function of the behavior as it can vary between individuals and works to inject other coping mechanisms in place of smoking. CBT also aims to support individuals suffering from strong cravings, which are a major reported reason for relapse during treatment. Studies have shown CBT to be an effective treatment for substance abuse. For individuals with substance abuse disorders, CBT aims to reframe maladaptive thoughts such as denial, minimizing, and catastrophizing thought patterns and healthier narratives. Specific techniques include identifying potential triggers and developing coping mechanisms to manage high risk situations. Research has shown CBT to be particularly effective when combined with other therapy based treatments or medication. Though many forms of treatment can support individuals with eating disorders, CBT is proven to be more effective treatment than medications and interpersonal psychotherapy alone. CBT aims to combat major causes of distress such as negative cognition surrounding body weight, shape, and size. CBT therapists also work with individuals to regulate strong emotions and thoughts that lead to dangerous compensatory behavior. CBT is the first line of treatment for bulimia nervosa and eating disorder. Non-specific research has identified internet addiction as a new clinical disorder like gadget addiction that causes relational, occupational, and social problems. CBT has been suggested as a treatment of choice for internet addiction and addiction recovery in general, as use CBT as part of treatment planning. A Cochrane review of interventions aimed at preventing psychological stress in healthcare workers found that CBT was more effective than no intervention, but more effective than the alternative stress reduction interventions. Emerging evidence for cognitive behavioral interventions aimed at reducing symptoms of depression, anxiety, and obsessive compulsive disorder in autistic adults without intellectual disability has been identified through a systematic review. While the research was focused in adults, cognitive behavioral interventions have also been beneficial in autistic children. CBT explores the link between thoughts, emotions, and behavior. It is a directive, time-limited, structured approach used to treat a variety of mental health disorders. It aims to alleviate stress by helping patients to develop more adaptive cognitions and behaviors. It is the most widely researched and empirically supported psychotherapeutic method. This strong evidence base is reflected in clinical guidelines, which recommend it as a treatment for many common mental health disorders. CBT aims to change how a person thinks, cognitive, and what they do, behavior. CBT therefore uses both cognitive and behavioral techniques. The specific interventions chosen depends on the individual's formulation. As I said, it should be customized, not tailor-made. Yeah, it should be not standardized. It is tailor-made. Okay. Main advantages of CBT are cost effectiveness, long-term outcome is good, does not have any adverse undesirable side effects like using medications, etc. So overall, CBT should be tried out, especially for all kinds of mental disorders. Face-to-face consultation with the therapist is advised rather than CCBT or internet CBT. Debates, discussion on open-ended topics like this can go on forever. Anyhow, let me pull the plug here. Anyhow, we'll meet again real soon with another interesting topic. Some of the statements, views expressed are solely mine, based on limited knowledge gained over 6 decades of versatile experience. Always watch these videos with the closed caption for absolute 100% comprehension as my sincere recommendation. Zillion times so far. I know I rushed through to complete the presentation within 20 minutes max. This is a time limit I had set myself to retain the viewer's attention as an hour. I know nowadays I exceed this time limit since I make honest attempts to cover the selected topic more elaborately, including so many intricate fine details, referring a wide variety of sources, in particular Wikipedia quite extensively, besides articles and books published recently. Besides, of course, I sprinkle my own salt and pepper and season it with my personal experience so far in my life and also intuition. stay at home as much as possible to maintain social distancing attributed to pandemic, novel COVID-19, and prolong your lifespan. Lead a healthy life. God alone can put a stop to natural, unnatural events, maybe bio-war and cyber war events like pandemics, which may lead to apocalypse and extinction of all sentient species of Earth for no fault of theirs. Rest in peace and harmony.